Okay. I'll go ahead and get started. Okay. So just to be clear, we are talking about the second exam in drug classification. You should know what chapters those are and all that stuff, but we will start. Okay, so the first question, degree to which an individual has the capacity to obtain, communicate, process, and understand health information and services to make appropriate health decisions. Does anyone know what that is? Basically, you can summarize it to they understand their health information. Does anyone know what that's called? So there's going to be health literacy, right? To be literate means you understand it, and to be literate in your health is health literacy. Okay. All right. So condition in which patients have low levels of plasma carbon dioxide due to increased respiration is called what? So if someone has low carbon dioxide because they are increased respiration, that is going to be respiratory alkalosis. That means their blood is too basic, right? There's another term which we will eventually cover, which is acidosis, which is the acidic nature of the blood. Okay. All right. Okay. So next one. A recognition by private, board, or professional organization that an individual has taken an assessment that demonstrates understanding of the qualifications of a particular profession is known as what? It is what you will all be trying to do in May. Anyone in the chat? There it is, certification. Yes, that is going to be certification. Okay, so this one is a 3-letter acronym. So 3 letters. This is a tool that helps a patient plan and manage his or her own health information. What is that? Anyone? It's going to be PHR, stands for personal health record. A lot of times when you go to the doctor, you'll hear them talk about, patient portal and all that stuff. That's basically accessing your health records electronically. So that's the PHR. Okay. Allied health students have the opportunity to specialize in linguistic competency by pursuing a career in what? So if you are multilingual, meaning you can speak multiple languages, you could probably work as a what? It's interpreter, right? So healthcare interpreter could be a good avenue for you. So especially those in pharmacy that can speak Spanish, there is a huge need for people in pharmacy that can speak Spanish, obviously. But that is a good avenue to go down. Okay. So I want everyone to be active on this one. This is a true or false. Just throw me out a true or a false. As a legal record of diagnosis and treatment, a patient's medical record is a conduit of information for physicians only. So is it for physicians only? That is definitely false, right? Just like we talked about, the PHR is something that patients can access their health records. It is not only for physicians. Not only for the patient, but also for like the pharmacist or nurses or any other health professional that might be taking care of them. All right, another one that you can type in the chat, pretty short answer. Electrolyte concentrations are measured in what unit? What unit are electrolyte concentrations measured in? Anyone? Is it milligrams? Is it milligrams per milliliter? It's not cc's. So when it's electrolytes, we're looking for milliequivalents per liter. So MEQ/L. Maybe tomorrow I'll bring out some of the lactated ringers solutions that we have, and you can look and see that says they're milliequivalents per liter. Okay, so that's electrolytes. Okay. Healthcare facilities base their appearance guidelines based on the regulations established by what agency? So we're looking for 4 letters. This agency sets the guidelines on their appearance. Does anyone know? OSHA. OSHA is right. So if you think about it, the reason that healthcare facilities are regulated like that and the way they look is people have to understand that there is a standard. You know, when you're driving down Coulter, you can see the big signs that say like hospital ahead, the big H or whatever. You know, the emergency room is always going to be a red sign. You know, there are certain standards for that. OSHA sets those. How much of an average adult's body weight is water? What percent? We're looking for between 50 and 60, right around that range. So it is a significant amount of weight. That's right around 50 to 60%. Okay, so this one's kind of a tough one. This involves a electrolyte. Hypercalcemia may be treated with what? So hypercalcemia is too much calcium. So what are some things that you can use to treat high calcium? There's one drug that has calcium in the name. Anyone? That is one. Calcitonin is one. Something else you can do is fluids. Also the zoledronic acid. Okay, so those 3. What about hypomagnesemia? So basically we're looking for low magnesium in the blood. It occurs concurrently with, so you'll see low magnesium with low what? And I kind of gave it away. It's low something. Low magnesium usually happens with low calcium. So magnesium and calcium are pretty related. Okay. True or false? Now I want everyone to throw a true or false in the chat, please. Ignorance of the law is an acceptable defense when prohibited procedures are performed and when life-threatening critical errors result. That's definitely false, right? You cannot stand in front of a judge and say, I'm sorry, I didn't know. You know, that is definitely not a defense. Okay. Next one. Magnesium sulfate can be administered by all of the following routes except. So basically what I want you to do is think in your head. So IV infusion, absolutely. We use magnesium a lot in IVs. Oral, so there is actually a magnesium sulfate solution that is an oral solution. IM, yes, so yeah, intradermal or subcutaneous is the one. So you will not see that administered that way. Okay, so this question basically, it relies on you knowing what metabolic acidosis is and when it happens. So metabolic acidosis occurs when excess acid is produced, so you have high acid content in the blood. You lose this thing called bicarbonate, which actually brings the acidity down, or the kidneys do not excrete enough acid. Okay. That is metabolic acidosis. Okay, so the 2 questions that are next are pretty much the same. They're just one word different. So think of ions. So negative charged ions are called something, and positive charged ions are called another thing. The way that I remember it is that if you think about a cat ion, if you draw a T looks like a what? A plus sign. So you can think of a cation is going to be positive and anion is going to be negative. So that's kind of the way I remember it. Maybe you have your own way, but cations are positive, anions are negative. Signs and symptoms of hypomagnesemia include muscle cramps, tremors, confusion, and tachycardia. So tachycardia means a very high heart rate, right? So I don't know if anyone remembers when I passed out the IV fluids, but there was a term that describes an equal amount of solution on each side. It's a balanced electrolyte concentration. Does anyone know what that is? A balanced electrolyte concentration. It's not hypertonic. It's not hypotonic. It's going to be isotonic, right? Isotonic, it means it's balanced. All right, so which of the functions is not associated with potassium? So regulates enzyme activity, yes, that's true. Assists with acid-base balance, yes, that's true. Also involved in carbohydrate metabolism, yes, that's also true. So there's one of the options that is not, and that is going to be bone formation. Which of the following is not considered personal protective equipment? Is it face mask, disposable gown, hair cover, or non-sterile gloves? So that one, I would say it's going to be gloves. So the gloves are replaceable. The gown and stuff like that, that is to protect you. Sometimes you can actually double up gloves and all that stuff. Yes. All right, so the next one. Which of the following allied health positions typically requires 2 years of post-secondary coursework? It's going to be a physical therapist, a neurologist, a pharmacy technician, or a nuclear medicine specialist. Yep, pharm tech, right? All the other ones are a lot longer. Which of the following characteristics is not considered a component of professionalism? So attitude, appearance, critical thinking skills, or work ethic. So I would say that critical thinking skills is definitely a component, sort of, but that's the one, right? Attitude, appearance, and work ethic are all going to be expected, I guess. So critical thinking should be, but that is the answer there. All right. Which of the factors is not related to the increased demand for allied health professionals? So does anyone know about that? Is the population of America aging? Yes. Are there rapid changes in healthcare information management? Yes. Are there huge technological advances in healthcare? Also, yes. So the other one is there. Which function is not served by the use of medical terminology? So does it allow for effective communication among healthcare personnel? So, we use terminology to describe certain things. So yes, it does allow for effective communication. Continuity of care. That is basically the same thing, right? If you describe something using a medical term to someone else, they will understand what you're saying. Avoids medical and medication errors. So I would say yes, but people have to be very careful not to use certain abbreviations. But the one that says provides an overview of scope of practice, there really isn't any medical terms that cover the scope of practice. All right, so this organization requires hospitals to provide a healthcare interpreter for anyone who needs one. This agency is over basically all of healthcare. Does anyone know of this agency? It is going to be the Joint Commission. Yeah, Joint Commission is the people that oversee all hospitals. Okay. So if I said that a solution is isotonic when it is balanced, what is something that has a higher concentration than the body? Higher concentration than the body. Hyper, right? When it says higher than the body is hypertonic. If it says lower than the body, it is also hypotonic. Okay. Does anyone know the pH of blood? Does anyone know that? It's kind of if you look at the answers, it makes sense. So I'm going to tell you the options. So the pH of blood, is it between 1.25 and 1.45? No, that's extremely too low. 3 and 5, that is also way too low, right? The pH of blood is between 7.35 and 7.45. Okay, it's right around neutral. It's a little bit on the basic side. Okay, so we talked about certification. This is the process by which the state board grants permission to an individual to engage in a, whatever. So basically it is the state board granting permission to someone. What is that called? It's what you all applied for as a technician trainee. It's going to be licensure. It's going to be licensure. Okay, and then furthermore, the process of being enrolled on a list created by the state board that governs a occupation is called what? So they're the ones who give you your license, but being on this list is called what? It's going to be called registration, right? Registration means you are on the list, the licensure that they give you, all that stuff. The study of standards of conduct and moral judgment that outline the rights and wrongs of human conduct and behavior is what? It's ethics, right? Ethics are basically saying right and wrong, moral judgments, all that stuff. These are things that, are basically basic values. When talking about hypo, hyper, and isotonic stuff, we're talking about the concentration of solutes, right? So salt. We also have water in between these membranes and, in between the body and all that stuff. What is the term that describes water moving across a membrane based on concentration of some solute? It's osmosis, right? Osmosis actually drives those forces. So if something is hypertonic, water will want to make it equal, so it'll move. What branch of medicine involves the use of computers and telecommunications to deliver healthcare at a distance? This one is kind of popular recently. It's in the word, kind of. Telephone, telecommunications, telemedicine, right? Telemedicine. What causative factor, so causative means like what, the cause of this is not associated with hyperkalemia. So first off, we need to remember what hyperkalemia is. So if anyone remembers the periodic table, potassium is K. So hyperkalemia is high potassium. So the question is saying what factor is not associated with high potassium? So this one is going to be vomiting. So vomiting will not change that. What condition occurs when plasma contains excess hydrogen ions, thereby causing the pH to drop below the normal range? So if the pH is dropping, is it becoming more basic or more acidic? If the pH drops. So if the pH drops, it's becoming more acidic. So that's acidosis, right? Because the lower the pH is, so if it goes from 7 to a 2, that means it's becoming more acidic. If it goes to like a 13, it's becoming more basic. What drug is considered a high alert medication by the Institute for Safe Medication Practices? And you'll see this a lot. You will see this all the time. It's going to be potassium chloride, right? So potassium is one of those that is considered high alert because it's dangerous. This one we will talk about a lot next semester when we talk about TPNs, but this one is going to be what route is used to administer a hypertonic solution. So we're talking a solution that is very highly concentrated that you can't necessarily put into a vein in your arm or your hand. It's going to be a central IV line. So a central IV line actually, they put it in a giant vein in your shoulder area, but it's just a bigger vein to put that drug in. What side effects are possible with calcium-containing products? So calcium-containing products. If anyone knows anything about kidney stones, they'll know that they are not fun, and that is also a side effect of calcium-containing products. So constipation is another one. Constipation and kidney stones are possible side effects with calcium. What sign is not associated with hypokalemia? So if you remember, we talked about potassium being K, so that's going to be low potassium. Decreased reflexes, that is one that is associated. So people will not have good reflexes when they are low in potassium. Weakness and confusion, that's another one that will be a thing that we will notice. Drowsiness and depression also. But depressed breathing is not one, okay? So that one is not associated with low calcium or low potassium. What term describes a fluid with a high pH? So if you remember when I talked about the pH dropping, it becomes acidic. So this one says high pH. Yeah, basic, right? It's the opposite of acidic. What term describes the actions, procedures, and processes that a healthcare practitioner is allowed to perform based on their regulations? It describes what they can do, basically. Does anyone know what that term is called? It's going to be scope of practice, right? Scope of practice defines what you can do as a professional based on your licensure, your education, your training. What term is used to describe the excess loss of body fluid, primarily water? What would you describe, or how would you describe the situation if you lost too much water? You are dehydrated, yes. So hydration refers to water, not having enough refers to dehydration. Okay, so we have two questions that are basically asking the same thing, but a different kind of question. This type of fluid assists in the body's cell function and metabolism, including the transport of food and waste products. So what type of fluid is that, or where can you find this fluid? If it assists the cell's function and metabolism, you'd probably think it's going to be inside of the cell, right? So that's going to be intracellular fluid. The next one is, this fluid plays a major role in maintaining the body's overall fluid status. So if the other one was, maintaining the cell's processes and stuff like that, this one is the opposite. So it's going to be the extracellular. So extracellular fluid plays a major role in maintaining the body's overall fluid balance. What type of solution is known as a maintenance solution? So right there, the key term right there I want you to focus on is maintenance. So if we are using a hypo or hypertonic solution, we're wanting to change something. We're using that concentration to change something in the body. So if we're wanting to maintain something, we don't want to change it. What would that solution be? It would be isotonic, right? Isotonic is going to be maintenance. What drug class is commonly used to treat edema? So edema. What drug class? Does anyone know? Yeah, so you can call them water pills. A lot of people refer to them as water pills, but they're specifically called diuretics. So a diuretic is used to actually pull the water out of the body, excrete it. That is a diuretic. Which electrolyte is used to treat metabolic alkalosis? Alkalosis. So alkalosis would be, it's too basic. Does anyone know? So it's going to be ammonium chloride. Ammonium chloride. Yep. Perfect. Okay. That honestly went by pretty quick. That was all 50. Does anyone have any other questions for me while we have a little bit of time? And if you want to unmute, you can, or if you want to just type it, you can as well. Is anyone struggling with the allegations homework that I gave on you need an interview time? Cassidy, did you sign up? You should all have access to the Google form where you can just write your name in the box. Cassidy, I believe I signed you up, if I'm not mistaken. Anyone else have any questions, or maybe something you want me to talk about on the allegations homework? Anyone? Yeah, Cassidy, I just need you to get on the Google form that I sent out and put your name in one of those blanks, and we will get you scheduled. All right, if you have no more questions, we are going to end the session, I guess. But if you do have a question, you can stick around and ask. It's up to you. That is all for today.